It's been illegal to sell tobacco products to minors for more than 100 years in California, but we've only, since 1994, have had what's known as the STAKE Act, which is the state-specific efforts to enforce this law. The main provision of the STAKE Act allows the state to go in and conduct what they call compliance checks, sort of a undercover operations, if you will, using minors to go into a store to attempt to purchase tobacco. And if a store sells to a minor, that's a violation, and there's a fine along with that violation. The unfortunate part of the enforcement program is that we have 13 inspectors statewide, whereas we know there are more than 30,000 licensed tobacco retailers in the state of California. Due to budget constraints at the state, it's been tough to expand that inspection army, if you will. And so SB 624 would broaden the authority to enforce the STAKE Act to include local law enforcement organizations. So a city or a county can develop a team under their police department, their sheriff's department, or their city attorney or district attorney's offices to go out and conduct these compliance checks. And if there are violations, then they can impose those fines and keep those fines as a local revenue stream.
Now, what happened? I mean, do they require a license to sell tobacco, or is just can anybody sell tobacco?
Well, unlike alcohol, I mean, you do need a tobacco license to lawfully sell tobacco products in the state of California. It's not illegal, it's just regulated, similar to alcohol. Unlike alcohol, a tobacco license is much, much less expensive, and clearly enforcement of the tobacco laws as it pertains to sales to minors are nowhere nearly enforced as we do the alcohol sale laws. Well, as we're negotiating in this building a reform to our healthcare system in the state, obviously we have a healthcare crisis in America. We also have a health crisis in the state and America. We have obesity and diabetes impacting people at epidemic proportions, and any good advice from a doctor or otherwise will tell you two things. We need to exercise more, and we need to eat better. This bill is targeted at the Eat Better recommendation. It's hard to make healthy eating choices when we're eating out if we don't have good information. Most restaurant chains are beginning to provide consumers the nutrition information for their menu items, but they'll only do it on their website, or they'll have a brochure behind a counter, for example. What this bill seeks to do is to bring that information out from cyberspace, out from behind the counter, and put the information where the consumer can use it the most, right on the menu or on the menu boards for fast food establishments.
Now, I'm just trying to think about how this would work on a drive-up window. Would it apply there as well?
Well, the bill would apply for both sit-down restaurants and fast food places as well. In a sit-down restaurant where you have a printed menu to look at, we're asking for 4 items for each standard menu item to list its calorie content, its carbohydrate content, its fat content, and its sodium content. For fast food establishments where there are no printed menus, there's what we call a menu board above the counter or in the drive-through lane. We know that space is an issue. It's confining there, so the bill only requires for calorie information to be posted along with a price.
Very good. And you think this will get the governor's signature?
Well, we're hopeful. The governor hasn't committed to it yet, but there's been some encouraging signs coming out of his office, and it certainly is one of the recommendations from his obesity task force that the legislature ought to seek to require restaurants to provide nutritional information to their consumers.